Good morning to all. We will discuss a few points regarding the radicular cyst. Everybody know about the radicular cyst, its clinical picture, location, those findings and all. We'll see something about the pathogenesis and microscopic finding, because this is somewhat important one. So we'll discuss these points today. Before going into radicular cyst, we'll see few things about the components of the cyst. The word cyst is derived from the Greek word meaning sac, bladder, pouch or bag. What are the main components, parts of the cyst? Microscopically, when you see a cyst, it will have a central lumen or the cavity. So cavity is the basic part of a cyst. In a true cyst, the cavity will be lined by a epithelium. The epithelium will be surrounded by a connective tissue wall. So the main parts are lumen surrounded by epithelial lining and connective tissue wall. So this is the component of a true cyst. Okay. When you say false cyst, means it lacks the epithelial lining. Likewise, a cyst can occur inside the bone and outside the bone. Inside the bone, it is an intraosseous cyst. Outside the bone, extraosseous. Likewise, a cyst can arise from epithelium. The source of epithelium is odontogenic, means it's called as a odontogenic cyst. If the source of epithelium is non-odontogenic, means it's a non-odontogenic cyst. Likewise, an inflammation can trigger a cyst. Then it is called as an inflammatory cyst. Or sometimes the cyst may be of unknown etiology. That is, the causative factor will not be known. That time it is called as a developmental cyst. Now, when you see the statistical analysis, this, of course, this present slide shows the study done in the South Indian population. But wherever the study is done, among the population, radicular cyst top the list, usually because it's the most common cyst. All of you know that radicular cyst is common in the maxillary anterior region, that is maxillary, central incisors most commonly lead to radicular cyst because of trauma. So anterior teeth are more prone for trauma. Of course, dental caries also can lead to, left untreated, can lead to radicular cyst. But most common etiological factor for the radicular cyst is trauma. So since anterior teeth are most prone for trauma, the trauma can lead to non-vital of the teeth, so which in turn may give rise to the radicular cyst. So this radicular cyst is more common in the anterior part of the jaw, maxillary anterior teeth, that is most commonly involved. Any gender can be affected, any age, but most commonly common in the males. Once the tooth suffers any injury, trauma or decay, it leads to death of the pulp tissue. The materials, necrotic materials from the pulp tissue can reach the periapical region. This necrotic debris triggers an inflammatory process in the periapical region. This inflammation in turn causes this cyst. So radicular cyst comes under the category of inflammatory cyst. Second thing is, it arises from the odontogenic epithelium, cell rests of Malassez. That is nothing but the remnant of the root sheath. Since inflammation causing the cyst and the cyst arises from the odontogenic epithelium, it comes under the category of inflammatory odontogenic cyst. Now, when you see radicular cyst is most common in the permanent teeth only when compared to the deciduous teeth. What are the reasons? Radicular cyst, of course, may occurs in the primary teeth also, but in case of primary teeth, most of the time it is what happens means steps are not taken to save the teeth. Any abnormality, any pain occurs in relation to the deciduous teeth, usually it will be removed. Once you remove the deciduous teeth, if there is any periapical cyst or radicular cyst, usually it will resolve. So it goes unnoticed. And sometimes the radicular cyst in the deciduous dentition is not symptomatic, so it also goes unnoticed. Then apart from that, any inflammation in the periapical region of the radicular cyst, any periapical inflammation in the relation to the deciduous teeth usually resolves on its own because of the structure of the bone. The inflammation will goes off very easily. So it may get resolved also or may get unnoticed also goes. So because of the above said reasons, the radicular cysts are somewhat less common in the deciduous dentition. Now before going into radicular cyst, once the pulp is died, it may be due to injury or dental caries, then it is that particular tooth is called as a non-vital tooth. The inflammation or infection in the pulp tissue reaches the periapical region. Once this necrotic material or infection from the pulp tissue, infection means that infection may be due to dental caries. These infection in the pulp tissue or necrotic debris, necrosis of the pulp can occur due to infection, due to decay or due to trauma also. So necrotic debris or infection from the dead pulp tissue once reaches the periapical region, it triggers an inflammatory process in the periapical region. This inflammatory process initially will be acute. That time patient will have pain or sometimes abscess formation, swelling also can come. When it is not treated, the infection goes for the chronicity. So there will be a persistent inflammation. This inflammatory reaction in the periapical region leads to the formation of a chronically inflamed mass of tissue in the periapical region that is called as a periapical granuloma. So it is in response to the inflammation or infection from the necrotic pulp tissue. So this periapical granuloma is a combination of collagen fibers, fibroblast, more number of blood vessels, endothelial cells, chronic inflammatory cells, lymphocytes, plasma cells. All these things collectively will be seen as a ball of tissue which is attached to the periapical part of the tooth. So periapical granuloma is a chronic condition, usually asymptomatic. It is seen in relation to the apex of the tooth. When time goes on, what will happen? The present picture shows the periapical granuloma. And the periapical granuloma usually consists of lymphocytes and plasma cells. Plasma cells, if more, means is called as a immune granuloma, less means non-immune granuloma. Usually plasma cell will secrete some immunoglobulin molecules that is seen outside the plasma cell. They are called as Russell bodies or pyronin bodies. When time goes on, this chronic inflammation, what will do means, will trigger the cell rest of Malassez in the periapical region to undergo proliferation. So you can see in this picture, root apex is seen. In the root apex, we are seeing a mass of tissue attached. This mass of tissue is the chronically inflamed mass of tissue, otherwise called as a granulation tissue. In this environment, we can see some neutrophils, lymphocytes. We can see some antibodies also secreted by the plasma cells. You can see IgG, IgE and complement component. In addition, we can see in the center of the granuloma, a cell rest of Malassez is also present. Apart from this, in this particular environment, periapical granuloma, there will be a less amount of that pH will be less. So acidic environment it will be, oxygen will be less, carbon dioxide will be more. So in this environment, acidic environment, oxygen is less, carbon dioxide is more. I have drawn a flow chart. You can see the dead pulp which consists of the bacteria. Bacteria reaches the periapical region. Once the bacteria reaches the periapical region, antigen-antibody reaction will goes on. Antigen is the bacteria or its product. Antibody will be produced against it. In this process, complement component C3 also will join. All this inflammatory reaction will causes increased vascular permeability. That is, vasodilatation will occur, increased blood flow will occur. This will increases the WBC count in that particular environment. So T4 cells, helper cells and B cells both will come into the picture. B cell will secrete the antibody, T4 cell will secrete certain materials called as lymphokine. These materials secreted by the T4 cells make the cell rest of malassez to proliferate. So thereby inflammation from the pulp tissue reaches the periapical region and makes the epithelium in the periapical region. What epithelium means? Cell rest of malassez. It is nothing but the remnant of the root sheath normally present in the periodontal ligament. This will be triggered by the chemicals secreted by the lymphocytes. So the cell rest of malassez begin to proliferate. So now pathogenesis. That is, pathogenesis means how a lesion occurs, from which tissue it occurs. Etiology means causative factor. Here the etiology is the inflammation. Inflammation is due to bacterial products or necrotic pulp tissue. They go to the periapical region, causes the inflammatory reaction. So this is the etiology. Etiology is the dental caries or some trauma causing the pulpal death. So necrotic tissue, bacterial material is the etiological factor. How this etiological agent causes the cyst, that is the pathogenesis. So the inflammation in the periapical region makes the epithelium, that is cell rest of malassez, to proliferate. So as the cells proliferate, what will happen? When the island or that aggregate of epithelial cells multiplies, it enlarges. So in this process, what happened? Earlier it was a small group of cell. After multiplication, it becomes a larger group of cell. So what happens means, some of the cells in the center portion of the epithelium may not get the nutrition because it's an expanding mass. So what happens means, blood supply from the surrounding connective tissue may not be able to reach the center of the cells. So what happens means, some of the epithelial cells present in the center will undergo necrosis. Now this, when the central cells undergo necrosis, the central part of that epithelial island will becomes the cystic lumen. That only this picture is saying. So when you see from the left side, okay, that is the initial expanding island. Once that island begins to expand, the cells present in the center of the island may be devoid of nutrition. So the cells present in the center of the islands will undergo necrosis by proteolytic action. Okay, these central cells, when undergo necrosis, the central part of that particular cell rest of malassez will be devoid of cell and creates a cavity. So thereby the cyst forms. So when the central cells die, a cavity is formed. Automatically the surrounding peripheral cells will become the epithelial lining. You can see it in the second diagram. So when time goes on, the plasma proteins from the surrounding connective tissue go into the lumen by penetrating into the epithelium. Then the lumen will also consist of the necrotic epithelial cells. Some immunoglobulins from the surrounding connective tissue go into the cystic lumen. So when plasma proteins and immunoglobulins penetrate the epithelium, reaches the center of the cavity, what happens means the osmotic pressure inside the lumen will be more because of protein content, whereas outside the osmotic pressure will be less. So what happens means, to equalize the pressure on either side of the epithelium, this central portion will absorb some water from the periphery. So water will enter the lumen till the pressure inside and outside the epithelium are nullified. Thereby the cyst expands. So initially central part of the island will undergo necrosis, creating a lumen. The peripheral cells will automatically become the lining. Once this is created, the surrounding connective tissue contributes proteins. They will enter the lumen. Once they enter the lumen, osmotic pressure inside the lumen increases. To equalize the osmotic pressure from inside and outside, that inside lumen will attract water from the connective tissue outside. Water enter the lumen as long as the osmotic pressure inside and outside are nullified. Thereby the cyst expands. As the cyst expands, it needs space inside the bone, because this radicular cyst occurs inside the bone at the apex of the root. So prostaglandins present in the surrounding connective tissue. The prostaglandins are secreted by the lymphocytes, fibroblasts and endothelial cells. That is PG. Normally we call it as a short form PG. Prostaglandins will resorb bone, create a space and for the expansion of the cyst. So thereby the cyst expands. Okay. Initially the island, that is the cellulus of Malus, expands by inflammation. Central portion undergo necrosis, forms the cystic cavity. Then the cyst expands with the help of the osmotic pressure. So this is the pathogenesis. Pathogenesis means from which tissue it arises. Cellulus of Malus. How it arises? That is the pathogenesis. So from which tissue it arises? How it arises? This is called as the pathogenesis. Etiology is the causative factor.